Mort Liebling, Sheila Ross, Lori Fenton Ambrose, Bonnie Adario, they're all pioneers who have been blazing the trail for change on behalf of lung cancer patients and survivors for over 4 decades. The roots of their activism go back to 1979, when Mort Liebling's lung cancer diagnosis turned him into a patient pioneer in search of something that did not exist: support and compassion for people fighting the world's #1 cancer killer annually. One patient's search ignited what would become over time a powerhouse movement dedicated to making the invisible lung cancer patient community visible. Their mission was to let the world know that the stigma, funding inequities, and lack of lung cancer research and resources needed to change. Mort Liebling's grassroots advocacy eventually led to the 1995 founding in Vancouver, Washington, of the Alliance for Lung Cancer Advocacy, Support, and Education, or ALCASE, at the time the only lung cancer patient-focused organization in the nation. In 1999, galvanized by the same imperative as Mort, 2-time lung cancer survivor Sheila Ross convinced ALCASE that the only way to accelerate increases in patient survival rates was to be at the center of policy discussions. As a former congressional staffer with 2 decades of experience on Capitol Hill, Sheila became the first patient advocate to walk the halls of Congress to bring attention to the needs of the lung cancer community. Following the advocacy path that Sheila set, in 2004, ALCASE relocated to Washington, D.C. and became the Lung Cancer Alliance, or LCA. Sheila also enlisted the help of her friend and former U.S. Senate staff colleague Lori Fenton Ambrose to serve as president and CEO. Together, Sheila and Lori worked tirelessly to establish lung cancer as a national health priority, with federal funding from our government, the biggest funder of cancer research, commensurate with the disease's enormous impact. Armed with burgeoning research proving the life-saving benefits of screening with low-dose CT for those at risk, they made screening for lung cancer a core organizational priority. Meanwhile, also in 2004, on the other side of the country, Bonnie J. Adario was diagnosed with stage 3B lung cancer. From that moment on, her life was redefined, and another pioneer was born. At age 56, Bonnie became one of 1.5 million people facing a grim 16% survival rate. Most doctors provided little hope, but Bonnie eventually found a thoracic surgeon willing to help, telling him, "If I'm going to die from this disease, I don't want it to be because I did nothing." Bonnie became a survivor with a new purpose in life. Although it had been 25 years since Mort's diagnosis, Bonnie still found it impossible to find resources and credible information about lung cancer. Everyone said cancer is a journey, but no one had a roadmap. Bonnie was determined to create one, and to become a powerful voice for patients facing this highly stigmatized disease. In 2006, the Bonnie J. Adario Lung Cancer Foundation, or ALCF, was born. Inspired by Bonnie's personal experience, ALCF's patient-focused, patient-first mission was the heart of the organization that became a leader in pursuing innovative research, providing free education and support resources, and championing advocacy to erase stigma and advance early detection. 2 years later, in 2008, Bonnie and her family founded a second nonprofit, the Adario Lung Cancer Medical Institute, or ALCMI, an international research consortium to advance groundbreaking studies, including the first ever study of lung cancer in adolescents and young adults under age 40. Although separated by a continent, the two lung cancer organizations, LCA and ALCF, have always shared the same goal and have partnered on many projects over the years. But it wasn't until 2019 that they became one. Now, as a unified organization spanning 2 coasts, they complement each other, working tirelessly as one team, better together, as the Go2 Foundation for Lung Cancer. Reaching 10 million people affected by lung cancer, the Go2 Foundation combines the vision of its pioneer trailblazing founders, Mort, Sheila, Lori, and Bonnie. As the world's leading organization dedicated to saving, extending, and improving the lives of those vulnerable, at risk, and diagnosed with lung cancer, they are transforming the meaning of survivorship for lung cancer patients and their families, and breaking down barriers to save lives. Dedicated to empower everyone, ignore no one, the Go2 Foundation's #1 focus is always the patient. Better together. Go2 for you for information and support services. Because we know that knowledge is power, we deliver free access to 24/7, 365 life-changing information and support services. Better together. Go2 for discoveries for patient-centered research. Because patients are at the heart of everything we do, we are advancing patient-centered, world-class academic and community-based research that spans the continuum of care. Better together. Go2 for action for policy initiatives. Because we know that to advance lung cancer care, it takes federal research funding, new treatment approvals, and better access to high-quality care, we empower millions to take direct advocacy action. Better together. Go2 for excellence for screening and care. Because life-saving services need to benefit all people, we are expanding access to excellence in screening, care, treatment, and survivorship to ensure that our community benefits from critical services closer to home. Better together. Go2 for motion for engaged community. Because building, connecting, and engaging our community across the country and worldwide is critical, we work locally and impact globally. Better together. Go2 for impact for high-quality standards. Because excellence is key to every facet of our work, we share knowledge, encourage public and private collaboration, and consistently meet the highest ethical and transparency standards as rated by the leading charity watchdog groups.